You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, board-certified periodontist, Dr. Joe Nemeth. Dr. Nemeth, welcome to the program.
Thank you, Randy. Pleasure to be here.
Part of your practice, which I invite you on the program to talk about, dental implants.
Yeah.
Very popular now.
Very
changed?
popular,
What's
but
changed?
not as popular as it's going to be.
Okay.
It's going to be hugely popular. Not long ago, I think it was Jane Brody in the health reviewer in the New York Times came out with an article saying that basically dental implants are now going to be the standard of care for replacing missing teeth. Because
Instead of what? Instead of what?
Instead
Bridges?
of bridges. Instead of bridges. Well, let me show you an example here. Let's say you're missing a tooth. You've broken a tooth, or the tooth has become decayed, you've lost this tooth. Well, how are you going to replace the tooth? Typically in the past, and sometimes still today, what they do is they make a bridge. They make a permanent bridge for that tooth.
Okay.
And how do they make the permanent bridge? You've got a tooth here, you've got a tooth here, you've got a missing tooth here. Well, you've got a gap. Okay, you got to replace that tooth. What they used to do in the past, would they grind this tooth down here.
Now, when you say what they used to do, isn't that how they do that every day now?
Most of the time, it's still done that way.
Okay,
But that's going to be changing.
Okay, you don't
Big
like that
time.
way.
I don't like that way, and people shouldn't necessarily like that way.
Okay.
Sometimes it has to be done that way, but not very often.
All right.
So they take this tooth here. Okay, here's the missing tooth. They take this tooth, and they grind the heck out of it. They grind it away, so there's a stump of a tooth left here. There's a stump. Then they take the one next to it, and they grind that away.
Now,
so
why do they do that, by
There's
the
a
way?
stump of a tooth here.
That's interesting. I didn't know that.
Because they have to put caps on these teeth. In order to
Okay.
put a cap on the tooth, you can't just put a cap on the tooth that's already there. You have to grind it down, and then you have room to put a cap on it. And why do you have to put a cap on it? Because the fake tooth, the false tooth, has to be attached. That's why it's called a bridge. There's an anchor here, there's an anchor here, and there's a bridge that goes between the two. And that bridge has the fake tooth on it, okay? So they grind this tooth down. They grind this tooth down, and
So that's standard dentistry today.
yeah, and they put a fake tooth
Okay.
attached to those two teeth. And they put that on these two teeth that have grind down, and they cement it on. So now you have a tooth here. The problem is when they cement that tooth on, that cement sometimes can loosen, sometimes can break, sometimes the bridge can get loose. The problem is when they grind these teeth down, sometimes they come close to the nerve, and the nerve can then die possibly in these teeth, and these teeth then may need root canal. Bridges are not known to last a lifetime.
So the solution is
typically.
what? Just get an implant, get your tooth
Get
back.
an implant. And not only that, decay can get under here and rot this tooth and cause cavity, and you can have problems or lose these teeth because of decay. Well, if you have implants, you don't have to go through all of that, okay? You have a missing tooth here. You have a tooth on either side. What you do is you put an implant in the bone here. You don't have to touch this tooth. You don't have to touch this tooth. You take an implant, you put a tooth on the implant, you're done.
The
implant.
This sounds pretty simple.
The implant, it's so simple. The implant never gets decayed. It's not made of tooth structure, so it doesn't get decayed. It doesn't get gum disease. Typically, implants will last a lifetime.
Knowing